Hello and good afternoon, and welcome to our today webinar. Today's topic will be about dyslexia in children, symptoms, causes, and cures. It is so much pleasure to introduce our keynote speaker for today, Dr. Edward Chan. He is a holder of PhD in psychology, Master of Science in Learning and Nutritional Medicine, honor in psychology, and postgraduate diploma in corporate psychology. Dr. Chan is a principal consultant psychologist at the Psychrop, the Center for Corporate Psychology at the International Psychology Center. He is a board-certified corporate therapist with the Malaysian Association for Psychotherapy and the International Society for Psychotherapy, Counselling, and Psychiatry, and the fellow of the Board Council for Psychotherapy. Dr. Chan was an invited speaker for the 9th World Congress for Psychotherapy in 2020, a keynote speaker for the 4th International Psychotherapy, Counselling, and Psychiatry Conference in 2020, and an invited speaker for the 37th European Psychiatry Conference on chemotherapy. He is also the author of Dancing with Crocodile, the key strategy of corporate psychology, and the author of the Love is Never Enough. Dr. Chan has published in the Journal of the Cognitive Therapy and Research, Journal for Reattached Therapy and Developmental Diversities, as well as International Journal of Psychiatry. So without further ado, please help me to welcome Dr. Edward Chan. Back to you, Dr. Edward.
Thank you for that kind introduction, Safura. And of course, Safura is one of our students at the International Psychology Center's accredited professional certification courses. And you're doing art therapy, right? Have you graduated yet or on the way?
On the way, almost.
On the way. Almost, fantastic. Great. Yeah, and you're from Turkey or something originally.
I know, I'm from Iran.
Iran, oh, beautiful.
Yeah.
I've been to Iran quite a few years ago. Wanting to go to Shiraz, but didn't have a chance, just was in Tehran.
Hopefully next time.
Yeah, hopefully next time. I gave a conference there. Yeah, beautiful country. Yes, the only drawback is you have to carry a lot of money with you because the banks do not take credit card.
Unfortunately, yes.
A whole bag of money. Okay, so yeah, so we're going to talk about the dyslexia in children specifically today, and we're going to look at some of the causes, how to identify the symptoms, and look at treatment strategies that are available, right? So I guess that the first thing to say is what is dyslexia, right? And then we can go from there. Of course, at the International Psychology Center, we do full assessment for dyslexia, and initially we will do a screening, right? So a screening is different from a full diagnosis, of course, right? A full diagnosis is going to take time, it's going to cost more money, all right? So before we do that, we can do screening, and today we want to talk a little bit about some of the symptoms so that teachers and parents can recognize them and know whether it is appropriate to do a screening for their child, right? Of course, dyslexia is normally linked with reading and learning, especially reading and maths issues, and even writing issues. All right. So it is linked with that. So if your children, I think Tommy is here, right? So Tommy, if you can share with us this developmental profile. Okay, so that today, apart from in contrast to the old days, we have some knowledge we use what we call a developmental model, right, of child psychology. So here is a nice, for those of you who don't have this, you can get this from us. This is from the CDC, I think, in the US Center for Disease Control. And if you look at the developmental milestone of say the language, right, the last one, and you have 5 years. If you go down to 2 years, 1 year, okay, cool. All right, so like 2 years, you can see that you can follow two instruction. All right, so they start following instruction, but how about reading? Anything on the reading that ask for things, talk in single words. All right, so here you have 18 months they're talking in single words. They use 1 or 2 words, names of things, right? So if you have children that they are by 18 months that they still don't talk 1 or 2 words, then that means they are behind, right? Whereas they cannot see the document very clearly. I don't know what you can do about that, Tommy. But the point is that there is this developmental milestone, all right, and we can pass this to you. So if there is some what we call developmental delay, then it might be useful then to do a screening, right, for language especially, right, because the dyslexia is where language is affected. All right, so when we do a screening, of course we do many other things. We would for example ask about whether they have any difficulties in their motor skill, in their right hand, left hand type of knowledge. I will ask them confusing things like point to my right ear with your left hand, and then see whether they get it wrong. We will ask them to do some spelling or to pronounce some words to see whether they have a difficulty. We will ask them complicated words like philosophical, statistical. They do not need to know the meaning, right? But if they cannot follow the pronunciation, then again, that suggests there's something wrong there. That might be part of the red flag. We might ask them about the name of the months, whether they can recite January to December. Again, if they skip some and they cannot remember some, then that again will be some red flags. We will ask them whether they have any family members that have some learning problem, reading problem, because there are also genetic causes as well. So once these are screen positive, so in psychology, medical term, positive is not a good thing. Like COVID positive, it's not good. So you can be dyslexic positive, but screening, then we would do a full test, right? Like an IQ test. We have the WellLab intelligence scale for children. But having said that, dyslexia is not, right? It's not an intelligent problem. All right. So although we use the intelligent test, what we call the WellLab intelligence scale, for children, which is a diagnostic test, we are not looking at the overall IQ per se. All right. We are looking at component of cognitive function, right? Cognitive just means your processing, your thinking processing. So your processing of information in a serial form, okay. So you need to take note of all these questions in the box, the Safura, and then raise it later. All right, we have a bunch of questions there. We will address it one by one when the time comes. So we would then do a full diagnostic test, and then only then we can make a diagnosis whether person has dyslexia or not. All right, so I said that dyslexia is not an intelligent problem because we have many intelligent people. In fact, there are more highly successful people like great entrepreneur. Yeah, 20% of them are dyslexic, whereas the normal population should only be 5 or 10%, right? So we have more artists, scientists who are dyslexic, like Einstein, who cannot read until he would suddenly be very late in this developmental milestone, right? Einstein, but I think he's failed his school maths as well. But still, he's of course very intelligent. But still, we are not saying these people, children, do not need help. They should, in Einstein's, they probably didn't have the help. They couldn't even diagnose him. So they still need help, because we're going to be talking a little bit about the secondary symptoms, right? Which is depression, anxiety, even suicide. The children get teased, they have low self-esteem because of these difficulties in reading, right? Unfortunately, in our society, and this is the thing, everyone, this reading importance that we place on our human society is a very, very late development. All right, my photo has, let me write this up. Okay, if you look at human civilization history, how do you think we used to learn, a few hundred years ago? How do you think, Safura, in Iran, how do people do that? How do you become like a like a witch, for example, a medicine woman? How do you become a medicine woman? You don't have universities and things, a few hundred years ago, couple thousand years ago. How do you do that?
Well, I guess it was based on experience. So
exactly. You find a master, all right? It's by the mentorship, by the following a guru, for years and years. You hear, you watch, experience. You don't read books. So this is a very, very late development, very unusual for our brain to do that. But today everything is books and books, So the fact that you cannot read become highly disadvantageous, right? You get penalized today, but not not the case. It didn't used to be the case, right? So that is putting things in perspective. So if you're dyslexic a few hundred years ago, it wouldn't be a problem. But now it's a big problem, right? Because of the change in society, right? So this is the whole concept of disability. It is a medical model. When I say you have a learning disability, it is as if there's something wrong with you, something in you, but that's not true. It is the environment. You have a disability only because you are in today's learning environment, which places emphasis on reading and writing. But a few hundred years ago, you wouldn't have a learning disability, right? So it's not in you, it is in the environment, right? So we should change our environment, not change the person, right? So unfortunately, we are a lot stuck with the medical model, of education, and this is the whole concept of educational psychology, of course, which we have courses on, and we need to do much changes, and this is how we have learning disability, special needs because of all these issues. So this is a quick tour about the issues. We haven't talked about, we touched a little bit about causes and things, but we can dive deeper into it. I don't know whether now is a good time to take on some question, or you have some question to ask, Safura.
Okay, Doctor, we have a question actually from participate also, whether can dyslexia pass through the generation or through generation? It means like, is it based on the gene?
Yeah, there is this is very new knowledge, but we have identified some genes, right? That are linked to the dyslexia. There are like no one single genes, but what we call the signature of genes. All right, and we run a lab here called WellLab, which if you go to our website, malaysialaboratory.com, you can see some of our gene tests. And there are also a gene linked to like sensitivity to omega-3, for example. All right, so that that can be a problem with dyslexia. So Tommy, can you share the book by Dr. Stordy? And so that everyone can see it. There's a nice little story, a story about Dr. Stordy, right?
Yeah, this is the book by Dr.
Right.
Stordy.
So this is the Jacqueline Stordy. Her own son has got dyslexia. Thank you, Tommy. All right. So this book is available, and what she find is that she can, like, cure. Right. This is not a word that is used very commonly in medical terms. She can cure, like reverse, with a full reversal of her son's dyslexia. And she had real problem with her son dyslexia, has real problem reading, writing, organizing things, but you can. And how she did it is mainly through nutritional intervention, right? Which is why she called it a remarkable nutritional intervention, the remarkable nutritional solution for dyslexia. All right, and the nutrients is basically omega-3. All right. So we have this test, right? So this is, dyslexia, you're looking at maybe 10 to 20% of the population. It's a high number, right? Of almost like 1 in 5 person, right? Will have the dyslexia. Yeah. So yes, Vera say cannot be cured, outgrow, right? So we will address that. Indeed, it can be reversed, as Dr. Stordy showed, but you need to do it holistically. That means physically as well as the psychological intervention. All right. So it's a psychophysical epigenetic phenomena. It's a lot of words. What it means is both physical and psychological. And now we talk about gene. Okay, so gene is half of the story. All right, gene is a loaded gun. You still need to pull the trigger. I'll give you a gun, loaded. If you don't pull your trigger, no one dies. But you pull it, bang. All right, so the environment is the trigger. Nutrition is the trigger. Okay, you might have some of these signature gene, but you eat right, so you have lots of omega-3, you will not get dyslexia, or you can even reverse it if you have dyslexia. All right. Yes.
Doctor, sorry, I wanted to ask, when is the best time for parents or teacher to screen their kids about their dyslexia? When is the best time they can check whether the children got...
Well, we have a look at the screen just now, right? Anytime on the milestone you have a problem. We talked about 18 months just now, where they have like 2 words, few words, and if your child by 18 months you don't have any word, all right, then you need to start to monitor closely, and maybe so I would say like around 18 months and above, if you should be able to get some words from your child. If it's a delay, they're not counting, they're not speaking properly, then this is the time to do some screening. Definitely. Yeah. So this is the meaning of epigenetic, right? You need to turn on the faulty genes. Okay. And the other thing to learn, to know, which is related, is the interaction between our brain and the environment. Okay, so so this is very new knowledge. We know now the brain is developing all the time. So this is the concept called brain plasticity. All right. So they've done a screening, and Tommy, do you find the scan by Dr. Aman on the dyslexic brain? You have the picture of that?
Your book doesn't have the scan for dyslexia brain.
The dyslexia brain in the the blue book, right?
Yeah, I already find your book, but it doesn't have the dyslexia brain.
well, you can just Google up. I don't have the book with me, but they found that in the dyslexic brain that there are some differences. All right. So normally we use like a few areas to read, but a person with dyslexia, children with dyslexia, they have only like one area called the Broca area of the brain. So the other area is like not working well. All right. But that is a bit how do I say, a bit complex. Okay, I don't know whether you know about taxi driver in England. In those days before the you know the GPS and all that. Well, they find that I don't know why they do that, but they find that this taxi driver. If you've been to England, the road is very complex, right? They take shortcut here and there, and they find that the brain of taxi drivers is much bigger than a non-taxi driver, and they speculate it is because they were using it, to drive around and all that, and not only that, they find that when the taxi driver retire, the brain becomes smaller. So that is remarkable. So what we know is when you use the brain, and then later they found this, of course, relating directly to reading, right? Children, normal children, and children with dyslexic children, the brain is different, but we don't know whether that is because the dyslexic children they do not read, right? So that is causing that problem. And then indeed, when they find that these children, they give them intervention reading, the brain grow faster than the non-intervene dyslexic children, right? So that means teaching them to read in a specific ways of therapy, we have that, and Tommy can show them our bit dyslexia menu. Do you have that with you, Tommy? Right. So we have a like specific method to coach dyslexia, teaching them ways to learn the phonology, and we haven't talked about phonology because they do have a phonology problem, right? Then the brain size can get more normalized. So this is why we mean what we mean about curing, right? Reversing. So it's both physical and behavioral combined together. So maybe time to take more questions, Safura.
Yes, doctor. So one of the question Michelle asked, how can teacher and parents identify the dyslexia, which I think you answered earlier to my question also, right?
Right. Yeah, that's right. So we have addressed that. If there's anything not clear, can ask us again about that.
And also we have another question mentioned, is dyslexia also common among the autistic children?
So the question is what? Do dyslexic children, well, this is another.
Amongst the autistic children, is it common between the autistic children or?
Right, so is dyslexia also common amongst autistic children? I mean, these are different diagnoses, okay? In child psychology, educational psychology, child psychological assessment, we have something called differential diagnosis, right? So autism and dyslexia is different, but there is a higher correlation. That is true. But it's not clear whether this is environmental or the physical, because Tommy, if you have the gut psychology book, you can show that. We know, for example, gut health, right, will play a role in giving rise. I'm not sure about causing, but certainly in making these conditions worse, right? Gut dysbiosis. Just now we talk about the omega-3 absorption, right? So you might have the gene where you have poor absorption of omega-3, plus all the food in today's environment. So those are common factors that can give rise to to both autism as well as dyslexia, right? But they are quite different. right? So if you just have dyslexia but no autism, then you don't have like what we saw just now, the tantrum problem. That is more frustration problem of emotional problem, which is more associated with children with autism rather than dyslexia. Okay.
And also we have a question that they asked, do the dyslexia children also throw tantrums or also engage in the aggressive behavior?
Yeah, so like I mentioned, this is more for the autistic children, not so much for the dyslexia. So the secondary emotional problem with dyslexia will be like low self-esteem, depression, anxiety, right? Because other people don't understand them, that they feel bad, that they feel they are like not bright, they feel they are stupid, you know, for not being able to or having difficulty to read, right? But they will not get very emotional and frustrated like the autistic children, because they cannot communicate well. So that lead to a lot of temper issues, you know, plus they're very sensitive autistic children. So it's a different issue here, right?
We have a question. Vero asked my son through a tantrum because he's upset that cannot read and he cannot write. So she asked whether is that dyslexia or...
Yeah, so certainly we can have you know, children who are frustrated, right? But we need to look at other symptoms. If it's like frustrated because he cannot read and write and feel anxious or even depressed, yes, you know, that is still very much linked with the domain of dyslexia, right? But if we start to have other what we call pragmatic language problem, all right? So pragmatic language is a language for social communication, like negotiate, asking a request politely, you know, understanding jokes. See, dyslexic children would not have such problem, whereas autistic children would. See, that's a difference. So we have at IPC we have the pragmatic language test, right? So this is another way we can differentiate between dyslexic children and autistic children. You know, Tommy, you can show the book by Tony Atwood. If you're interested more in pragmatic language, you can read the whole chapter by Tony Atwood, who is the like you know, one of the pioneer in autism or Asperger's syndrome, right? So and we have this pragmatic language test that can differentiate, you know, children with pragmatic language.
Doctor, this is the book.
Yes, the guide for parents and professional. We have another one which is more for professional as well. All right, by Tony Atwood, is the one of the pioneer for autism. I think Tommy, you can tell the Zoe that there was a student that was like looking into interested in dyslexia. You can send her the link to join as well. I can't remember her name, right?
Okay.
Okay. Any other question? She was interested in autism and dyslexia, I believe. Yeah.
Actually, I have a question also. Is my question, Dr. which is myself. It is interesting because I started reading and speaking since early. I was writing also when I was 6, but I always noticed that during my classes, I might skip the word when I'm writing the word. When I'm reading the title or article, I might skip a certain word as well. So my parents always thought that I'm not concentrating very well. So they try to solve it, but when I know about the dyslexia, I always thought maybe I have a dyslexia also, because it's my constant like
right.
that.
You might be, and we can do a screening for you and even a diagnostic test. We have the adult version. All right. So and of course there are many adults like Richard Branson, who is a very, you know, just flew into space, I believe. You know, who has dyslexia, you know, and he was like very active from young, you know, 16 years old, he's already become an entrepreneur because of his dyslexic problem, or not a problem, but his dyslexia gift. It depends on how you frame it. It can be a gift, rather than a problem. So it depends on the environment, right? If we want to treat it as a problem or a gift. So so you mentioned a couple of things, Sephora, right? Whether it is you are skipping this reading, right? So it can be what we call a phonological issue. Okay, so this is the other problem dyslexic children and even adults will have to their phonological awareness and processing. So in IPC we have a phonological test, right? So like even with a native speaker, right? I don't know whether you have like problem listening to people, even Iranian speaking, do you have that problem?
Not listening, but I had this problem when I was, even in my language, Persian, when I was writing, I always skip the words, single words. And my teacher, they never realized the
So that is the commonality with all language. It is sequential, even in Persian, it is sequential, just like English, and it's also phonetic, right? So this is a problem for dyslexic people, right? The phonological awareness, the how to perceive the different sounds, segment them, like rhyme, if I give you a very simple word like cat, it's k, right? So you might not be able to hear it, and you will hear a different thing, right? So that is definitely a dyslexic problem, which is different from the ADD problem, which is the attention, because of your executive function not doing well, you cannot focus. Is a very different problem. So this is a very specific sequential perception and a phonological problem. Yeah, so yeah, you might well have that. We can do a test for you, Sephora, but sounds like that's the one, not not ADD instead, and it can be resolved, right? To practice, to nutrients, looking at specific nutrients, like in our lab we have a test called omega-3 index. All right, omega-3 basic, it's just a simple blood test, and you look at how much omega-3 you have. And then we look at also a more complete called omega index, looking your omega-3 and your omega-6. You see the omega-3 and omega-6, they share the same enzyme, to be converted into the brain, to be utilized. Like they use the same door, but the problem with today's diet is too much omega-6. So as a result, it blocks all the omega-3. Okay, so there's a problem with fast food, with junk food, biscuits. They have a lot of like trans fat. Our tests also measure that, all the trans fat. You eat bread, you eat biscuits, French fries, then all your omega-3 get blocked. So it's no point you take a lot of supplement. Omega-3 is all blocked. Even if you eat eggs, in the supermarket, is all the wrong type of eggs, because the chicken are fed, not natural anymore, right? There's fed corn, which has a lot of omega-6. You need to go and find those kampong chicken where they eat worms and things. So everything is wrong in our diet and environment. So that's why our brain is also wrong as a result. Okay, so things can be fixed, but we have to go back to the basic, fix the food, fix our diets, and then we can also look at the way that we learn as well, right? And work on the psychology and the self-esteem and all that. Yeah, good question.
So Michelle asked Doctor, what are the strengths of the dyslexia children?
The strength.
Yes.
Okay, well, a lot. But because like we say, like more than 20% of entrepreneurs are dyslexic, artists and all that. So one of the strength is because of the area of the brain that use more the right side of the brain. The right side is, of course, responsible for art, and that's not surprising. You love art, Safura.
Yes, and I'm left-handed also.
Exactly, yeah. So it is, more dyslexic artists, like helping people, actors, because of the right side of the brain, because of language side is they're having issues with that, and they're focused more on the right. So a lot of strength, of using the right associated with the right side of the brain, right? Seeing the big picture, the holding, looking at the relationship of things. So in the IQ test, that we do, then we can identify many of these areas, non-verbal IQ. This is where the strength is. Yeah, definitely.
Interesting. And Dr. Shelley asked, can exercise stimulate the brain, better interaction, or improve the memory?
Can we stimulate the brain to have better memory?
Yes.
Well, yeah. I mean, if you're dyslexic, then it's better you use things like mind mapping, which is like focusing on the right side of the brain. You have pictures and everything, right? Then the traditional way of memorizing, your subjects, right? So yeah. So if you're dyslexic, then look at the mind mapping, for example, pictorial representation. Art. It is a ways to stimulate, your memory using your strength, right? Yeah, rather than struggling in the conventional way.
Doctor, can I have one more question?
Please,
Vera.
please, yeah.
Vera mentioned my son is having problem with math due to his dyslexia. What is your suggestion on his practicing his academic development? He's 12 years old.
Right. Yeah. So in terms of the development, if you come to our center, we have ways, right, to help him read better and write better. One of the ways is for example, we differentiate the letters. So the letters is very confusing for the dyslexic, right? Because the way that we perceive letters and alphabets and phonology is we like do a 3D rotation on them, right? On things, right? But when we do that on letters like B and D, then we get confused, right? And P and Q, and that's often the problem with dyslexic. So we would put them in a way that would emphasize more, so that it's easier to make that distinction of the P and Q. So we would like put all these letters around. We will play games with them, and then they can find it in a sequence. So there are many exercises that we can do, which make things easier in terms of the phonological processing, of letters, of sounds, and all the sequential information, right? Like timetable, for example. There we find ways to make it easier for them. So so we contact us, and then we can work a little bit on that. But on your own, you can like cut out letters and make them into different shapes and things, and play games with your son, so that he be able to feel. So this is a big problem now with COVID, with the online, like what we are doing now, because we cannot feel, we cannot touch. It's a multi-sensorial. So as a dyslexic child, you need all this multi-sensorial experience. So virtual is not a good idea. We already have the problem with the reading environment, and now we have the virtual environment. So you have a double whammy if you are dyslexic or ADD child, or even autistic. So it's not good things for a lot of children with special needs. Yeah, we probably need another session on see how we can like use a virtual environment, you know, in a better way. But definitely, it is not easy. Yeah. So, any other question? What else haven't we talked about? We on the phonology, Tommy, if you can show us the you know, the phonology test we did, right? Yeah, so this yeah, you can read my mind, Pat. So you can show that sample report showing the graph, Tommy. So this is a phonology test. One of the way that we can diagnose dyslexic children. All right. So I want to see the graph. Do you have the raw score of the graph? You know, from the raw score. This is all the nice report. But how about the raw score from the graph? You know, we have the cross. Not this, Tommy. Do you have the graph? Okay, maybe we can just stay with that page. All right, just stay with that page. All right, so this is the results of all the things we test in this phonological test. All right, so the thing to note is the non-words. All right, so we have words and non-words, right? And you have areas when they have a problem. So we have a non-word problem as well with the dyslexic children. Okay, because these are phonological sound, right? So when you have this problem, by being you know, the question just now, the Pat was asking about bilingual, you know, so did this become more of a problem? All right, so if the dyslexia is indicated, I would suggest you try to focus on one language, you know, which is confusing enough, and then you add another language, it becomes more of a problem, because we are measuring all these different measurements of phonology, right? The rapid non-symbolic naming, right? So this is a problem. Okay. So if you go down a little bit, Tommy, you can see what all this. Yeah. So no, I want the definition of just now go up a bit. Yeah, stay here. Right. So this is all the things that we do in the exercise, like, you know, ability to remove phonological segment from spoken word to other forms, to like a written word, you know, synthesize it. So all these become a problem, you know, for word and non-words for dyslexic children. Okay. Cool. Right. Any other question? And my screen has no worries, Pat. I cannot hear you, Tommy. Do you say something?
No.
Okay. Let me. So any other questions, Safura?
I wanted to ask, like, again, sorry, it's a related question, because I'm an art teacher as well as beside my full-time job. But sometimes, like, children, like myself, I mean, when I was child, my teacher, they didn't realize that, because they didn't see any problem in the other side of the study. So it was a small point that I was skipping, right? So they couldn't realize. So how do you suggest, like, a teachers or art teachers or art therapists, as an art therapist, you can realize that children, they have a dyslexia, even minor dyslexia, to solve it?
Yeah, so it depends on the age of the child, right? So you need to know a little bit about that developmental chart. Yeah, but typically not only in terms of spelling, reading, you know, but even maths, because maths is also sequential, right? Your timetables. So anything to do with a sequence and phonology, right? The sound of things, the child can have difficulties with. And even fine motor skills, right? Coordination, your right hand, your left hand is one of the things that we test as well, right? And in fact, this is one of the intervention, what you call cross-lateral exercise. You know, you use your left hand to cross to your right to your left. So these are, you know, like, yeah, doing martial arts is, I will highly recommend, you know, for children to do, right? It's a great activity to stimulate the left side of the brain. So any exercise to do that, you know, will be very beneficial, right? So this is how you can tell some of the signs, right? Whether some of these symbolic activities it is a problem for them or not. But even in terms of speech, because it's also a phonological problem, right? Even with and this is one of the way you can differentiate. Okay, in terms of in terms of native speaker, right? So like the phonological test. So you want to see whether these children have the same problem in their own language, right? If they have it in a foreign language, then fair enough, right? But if they have the problem in their own language, then this is an indication of a real red flag of a problem, right? So this is a differential symptom, right? Diagnosis for you to look at. Like you say, you have problem even understand Iranians. Okay. Yeah.
Yes, because like, for example, when I see back to myself, I see I could have speak very well, and everybody was telling me, oh, okay, she's a talkative, she speaks very well, and I could write. I mean, I could write, but I would have, for example, skipped a word, for example, cat and dog, and in between, always it might be a skip, you know. So I was wondering, my teachers, they never realized that if I'm skipping the certain word, maybe it's a dyslexia, or when I'm reading, I'm not really.
Yeah. So unfortunately, yeah, this is you know, not trained as well in teachers training, and that's why we have these courses, right, to train more dyslexia diagnosis, assessment, and intervention. You know, for more people that get help, because a lot, you know, like 20% of children and adults have dyslexia, and it all can be helped a lot, right? Yeah, I mean, these are all very gifted people, right? But differently gifted, right? So they all still need help. Not everyone will become an Einstein, you know, or Richard Branson. So we all need help. Fantastic. Yes. So there is a question about the cause of vision or something. Let's see. Is the cause of vision cannot see symbolic words, so what influence reading out or understanding it? Well, it is about having a multi-sensorial input, right? So it is true that I think even in Malaysia, right? If once we given you a diagnosis of dyslexia, you can go to something called pendidikan khas, you know, which is like a special department for special needs to get special help. Like a teacher reading out the exam question to you. You have more time, maybe even using a keyboard, right? So all this will be helpful because it's multi-sensorial, right? And so it's not like only you hear the question being read, you look at it as well, and then so there are more clues for you to put it together, and that's why it is better. So dyslexic children need more of that, right? To get the understanding that we require, rather than just reading. They can hear it as well. So I think that's a related question. How can the teacher help? Then same thing, you want to use multi-sensorial type of teaching method. Okay, just reading out, you need to write it down, and then the words need to be put so that it's more differentiated, it's slanted differently, right? So like the P and the Q, so the P and the Q top, cannot be at the same proportion. Otherwise, it'll be very confusing for the dyslexic children, because when they turn it around in the 360 degree, then you'll be the same. It is like, if you have this cup here, you rotate it around, you know that it is different. But when you put a P and a Q, and you do that, and you all look the same, then you don't have as much clue, right? So that is the problem. You need to present the letters in a way, in a slightly different. We have that format. We can those material we can share with you. You can order that, and use that for your own children, or teacher can use in the classroom. But it need to be a little bit modified from the standardized way of presentation of visual input. All right. Yeah.
Thank you, Doctor. And also Shirley asked about, she said, I know a teacher who had dyslexia, and she only realized after she joined the university during her tutorial. She said she could memorize before the exam, but after exam, she can't remember anything. She asked how this happens.
Well, because there's a disconnect between the, so there are three parts in reading, right? There's the semantic, which is the meaning. There is the phonology, the sound, and then there's the orthography, which is the physical input, the letter. So there's a lack of connection with this element, and that's why you have a photographic memory. You just memorize it, but then you don't link it to the semantic, and that's why it's easily for you to forget. Right? So we need to find other ways to make that connection with the semantic. Right? Otherwise, it's just like a parrot memorizing, but they don't know the meaning. Right? Yes. So we are reaching nearly time. Any last minute question? It's a very interesting subject, very complex. There's a lot of needs to really give help to children, so that we prevent all the unnecessary suffering. Because if you don't help them, then they have depression, they have self-esteem problem, and teachers and friends that they're not kind, they pick up, pick on all these dyslexic children who are functioning differently, different gifts, different intelligence, not because they are disabled. So we need to change our thinking about that, right? So they're having different gifts, that they function differently, because we change our environment. It's not their fault, for thousands of years. Oh, we don't need reading, and now suddenly we emphasize on reading. Our brain are not like gear for that, right? So that is the problem with the environment we have constructed, right? So simple fonts and phonics, yes, but you need to put the fonts in a way that they are different from each other, right? So we need to do that as well, not the standardized fonts. Yeah. So excellent. So yes, don't give up, and we can do a lot, and we can even reverse, right? But we need to do it holistically, physically, diet, exercise, and all the the bilateral exercise, and as well as so one thing don't do is more tuition. Because then the child will feel stress, and so it's not about having more tuition. So don't do that. You need to do things differently. Einstein said doing the same thing leading to the same result is insanity. So yeah, so coming from a dyslexic person, that is good, right? So do left-hand people face this problem? Yeah, more so because of we mentioned, that because of the right is a left brain problem, right? So yeah, so tend to be a left-handed as a result. All right. So fantastic, wonderful conversation, Sapporo and everyone, for all your questions, and we'll wish everyone well. Sapporo, shall we end here?
Thank you very much, Doctor. It was a really interesting topic, especially for me, and I hope everybody enjoyed. Thank you for
And
your
now I
time.
understand why you are having a special interest in this topic.
Yes, because always it was a question for me, and I tried to solve it, but it was really, really interesting and helpful. Thank you so much for your time, Dr. Edward.
Yeah,
And
you're most welcome.
hope we continue with the next topic and we learn more from you.
Sure, will do.
Have
Okay. Thank
a
you.
good day,
Bye,
everyone.
everyone.
Thank you.
Bye.
Bye.